Welcome to the month of November, and we are bringing you another important health video from our friends and partners at UTMB Health. They are preferred providers for the League City, Bay Area, Galveston, all of you people to the southeast, but they are bringing you great and important information, things that you need to know, or maybe your friends or partners need to know. So today we were talking about something a little bit different. And I would say the theme of the video is it's common, but not normal. We are talking about pelvic floor health issues. So, what is pelvic floor health? What does that even mean? How do you know if you're having issues? If you are having issues, where do you go? How can it be rectified? So we have two great experts that we're bringing to you in this panel. Dr. Nikki Milburn is a GYN with UTMB Health. And then we have Haley Jordatis. She is a physical therapist who works specifically for pelvic floor health physical therapy. So I think it's a great video. I hope you will tune in. So Haley, you are one of the PTs, pelvic floor physical therapist with UTMB Health. Tell us a little bit about what you do, and who would you be seeing as a physical therapist for pelvic floor health?
Absolutely. So we're treating women throughout the lifespan with symptoms of urinary urgency, frequency, incontinence, fecal urgency, frequency, incontinence, things like pelvic organ prolapse, diastasis recti, and then this huge pelvic pain umbrella, which could encompass pain from endometriosis or interstitial cystitis, pubic bone pain, tailbone pain, round ligament pain in pregnancy, pain with intercourse, painful scar tissue, all of these things under that huge umbrella. But none of these symptoms are normal, although they are common, especially in the pregnancy and postpartum period. And so PTs are trained to assess the musculoskeletal and neuromuscular systems and then look for dysfunction in these systems that may be contributing to the symptoms that the patient's presenting with.
So I really appreciate how you said they may be common, but they're not normal. Because just because we're hearing about them all the time or being like, you may be experiencing them, but it's not necessarily okay. Dr. Milburn, you work with PTs like Haley. What does that look like for you? How do you know when to refer out to a PT? What are you seeing women come in as their chief complaints?
Yeah, so any patient that has any type of pelvic floor disorder can be referred to PT. So if they have incontinence, if they have a prolapse, if they have pelvic pain, like she said, postpartum patients, all these patients can benefit from physical therapy. And if it's just identifying some weakened muscles to re-strengthen, or is it actually identifying pain points that they need to work with? All patients with pelvic floor disorders, which includes all those diagnoses that Haley and I just said, can be referred to physical therapy. And most of the patients that come to see us in Urogyn don't realize that they can be referred to physical therapy, or they may say, oh, I've done Kegels before. They think it's only Kegels. And so it's our duty to explain to them that pelvic floor physical therapy is much more than just Kegels, and any woman can benefit from it.
So you say that, and so how are you opening up these conversations with your patients? Are they coming in and are they complaining of these issues? Are you discovering them through questions? What does that look like?
So a patient may present to me with complaints of incontinence. And there's two types of incontinence. So once we talk about the two different types of incontinence and we identify with the patients which type of incontinence they have, we also talk about, or we move on to talk about the treatment pathway. And the treatment pathways for all incontinence includes pelvic floor physical therapy. So we as providers make sure that we offer all the therapies available, and physical therapy is at the top of the list for pretty much any type of pelvic floor disorder.
So to back it up to like basics, like Reader's Digest 101, what is incontinence?
Okay, so incontinence is involuntary loss of urine. So you can have that involuntary loss of urine when you cough, laugh, or sneeze. That one is called stress urinary incontinence. Then you can have incontinence on the way to the restroom. So you have an urge to go, you're trying to make it, can't quite make it, you're leaking. That's called urge incontinence. So any type of involuntary loss of urine is called incontinence.
Okay. Thank you for that. So
You're
that's the incontinence I experience when I'm jumping on the trampoline.
That
And
was stress incontinence.
I've had two babies and we just don't jump on the trampoline. We just don't do that. But we could, Haley, right? Because
Absolutely, yes.
there is a physical therapist and a pelvic floor physical therapist who can help with that. So what does that look like once they get to you? What kind of things can you do to help that pelvic floor?
Absolutely. So our first session is normally our initial evaluation. We're doing a thorough history, just discussing progression of symptoms. And then we do most of our assessments in that initial evaluation. And so this just gives us a greater understanding of what's going on so that we know how to treat it better. So we look at things orthopedically, like, strength around the pelvis, spine and hip range of motion, flexibility, breathing patterns, intra-abdominal pressure management, coordination of the lumbopelvic complex and how loads are transferred, body mechanics during activities like squatting and lifting. So we have kind of this holistic orthopedic lens. And then if warranted, and if the patients give the okay, then we do that internal pelvic assessment, which is different than a gynecological assessment. We don't have any tools or anything like that, but we do assess those pelvic floor muscles. And like Nikki was talking about, we look for any trigger points or pain areas that may be contributing to the symptoms that they're having. And then we look at strength and kind of get a baseline for how strong those muscles are, the endurance of those muscles, and then how they're coordinating with muscles like the diaphragm, the glutes, the core, the adductors, how they're coordinating with increased abdominal pressure. So we're looking at all these things. And then based on that, we have a good picture of what's going on. And then we move into treatment where we're treating what we find. And so sometimes that looks like mobility work. Sometimes that looks like strength work. Sometimes that looks like manual therapy techniques from the therapist, or a combination. Oftentimes it's a combination of all these things. And so we have an hour with patients, and every session we're kind of reevaluating, make sure we're on the right track.
Yeah, so I think, and I mean, for our audience, I have had PT, pelvic floor PT, and so I maybe wasn't expecting the whole internal thing. And so how do you talk to people about that? Because it feels, I mean, not that it feels weird, but it is something that is, I feel like it's fairly new, but it's not. I mean, mine was like 10 years ago, but how do you talk to your patients about that, and what that does?
We're always educating. A lot of times patients come in and they don't know what goes on in pelvic floor PT. And so we always educate on that pelvic floor assessment if it is warranted. And the patient always has the option to say no. So if you're not comfortable with doing any internal assessment, we can definitely do PT without that internal assessment. What's most important is that you feel like this is a safe space where you feel protected and you feel like you can share everything. And so, of course, you're always welcome to say no. We can still progress, but that internal assessment gives us, like I said, just a baseline of where we're starting. Because based on what you're telling me, I, put a plan together in my head, or what I think is going to be present whenever I do an internal assessment. But there have been patients where I think something's going to be there, and then it's the complete opposite. And so that internal assessment does give us some valuable information.
Yeah, and it's not nearly as like scary or weird. It just becomes part of like PT. And I went through it. They did a lot of like hip alignments, and I mean all sorts of other things outside of that. And so and it worked. So here I am, a testament that I actually can jump on the trampoline now. Dr. Milburn, why is pelvic health important? Um, why should we, I mean, because again, common, not normal. So why is it important?
So pelvic health is important because if you are having issues, most of the time, The pelvic health issues are incontinence, the leaking of urine, or you may have fecal incontinence, so the involuntary loss of stool. You may have a pelvic organ prolapse, or you're not able to enjoy intercourse with your partner. So it affects all areas of your life when you have a disorder of your pelvic floor. So it's really important to not ignore the signs of your body or feel like as a woman that you have to live with certain things because it's natural. And like Haley was saying, these things are very common in women. So women have been told that you just have to live like that, but you do not. You know, we have things that can help you. Even you not being able to jump on your trampoline, that's affecting your quality of life. And so that's the main thing that we want to make sure that women understand, is that things that affect your quality of life are important, and there are things that we can do to help you. So come and see us. We can give you all of the options available, and then you get to choose with your provider which one is going to be best suited for you.
I love that. We deserve it, right?
Yeah, absolutely.
If we've been through all of this, childbearing, I'm assuming is kind of a big cause of poor pelvic floor health. So Haley, what are the contributing factors for poor pelvic floor?
Probably more than we recognize on a daily basis. It even goes back to water intake versus bladder irritant intake, what your urinary habits are, nutrition, fiber intake, how that impacts your bowel health, lack of movement throughout the day, or poor movement patterns, poor body mechanics with activities like lifting your kiddos, poor breathing patterns. So all of these can contribute to poor pelvic health, as well as just labor and childbirth in general. Whether you're deciding to have a vaginal delivery or a C-section, either one of those are a trauma to the body, and they have a huge impact on the pelvis.
So I find it interesting the water and the fiber and all of those things. And then also, I mean, holding our pee probably, because we do that as moms on like the daily, where it's like, I'll hold it one more second because I have one more thing to do and I'm gonna grab this cup. Dr. Milburn, is that what you see kind of in the practice?
Absolutely. And of course, me being a nurse and a lot of my friends being teachers, those are the main patients that this problem affects. And over time, you're just like a rubber band. When you stretch something out so far, it's going to weaken. So our pelvic floors are affected by our poor bladder practices, our poor bowel practices. And so we have to be cognizant of and aware that these things are going to lead to long-term problems.
Okay, and Haley, so to that point, what should we be doing to improve our pelvic floor health? Not that we don't want to see you, but just saying.
I think slowly changing some habits over time can definitely make a huge difference. That may look like moving your body more, going for a walk, going to the gym, starting a new class, whatever that looks like for you. Maybe drinking your daily recommended water intake instead of living on coffee and diet soda. It may look like, just making sure you're getting your vegetables and fruits in, getting good fiber so that you're having a daily bowel movement, you're not constipated, all those things. But if you are having true dysfunction, whether it's incontinence, pain, or anything else that we talked about, just advocate for yourself and ask for a pelvic floor PT referral.
Yep.
I think that's super important that you know that it's there and it's available. Dr. Milburn, anything to add to that?
No, I think she pretty much covered it all. But the main thing I think that we want the audience to understand is that although very common, and although your mother or grandmother may have experienced those issues and did not seek intervention, it is okay for you to ask your primary care provider or your gynecologist, hey, can you refer me over to a specialist? I'm dealing with XYZ. And I really would like to know what my options are to take care of this.
Great advice. Haley, any lasting thoughts?
I would probably say give yourself some grace. Postpartum is not easy. Motherhood isn't easy. But like Nikki said, just advocate for yourself. If you feel like you have true dysfunction, there's people here to help you.
Yes, we love that. And we love knowing that there are providers like y'all out there who can help us with these things that We may have been, embarrassed to talk about 5, 10, 15 years ago, but I love that you guys are super mainstream now and you're available and you're there. So Haley, again, is one of the physical therapists with UTMB Health, specifically for pelvic floor therapy. Dr. Milburn is with UTMB Urogyne, and they are there to support you. If you don't have a primary doctor, that's the first step. So we want you to have a primary doctor. So we're going to put a link in the comments below that tells you exactly how to find a primary doctor at UTMB Health. We're going to put links to both of these programs so that you can contact if that's something that you feel like, maybe this isn't something I really want to be dealing with. There are ways to help. And we can get you in touch with these programs. So, ladies, thank you so much for joining me today.
You're welcome.
Absolutely. Thanks for having us.
So good. We will be back next month with another episode of UTMB Health Series, covering another really important topic, things that you need to know and that are important to your family and friends to keep you healthy and safe in Houston, especially this holiday season. Take care.